Hello, everyone, and welcome to the Cassie and Friends webinar. A few quick reminders. If you are looking for this in French today, please note that you can click the interpretation button and have it in French for yourself so that we have that option available for you. My name is Jennifer Heeley. I'm MC for the day, and I'm also the very proud parent, Miss Devin Nichols, sitting to my side here. I'm also a Cassie and Friends board member, and we just want to welcome you to Pain Can Go Away, Tips and Tricks for Managing Pain. Now, I know we have Heeley there in the chat, and just to keep things fun, because Devin and I are actually from Windsor, Ontario, just outside of it, but visiting Vancouver right now, just to build a little camaraderie. If people want to put in their chat where their favorite vacation was and what they did on that vacation, and we'll all get to know each other a little better. Just want to remind everyone that your mics are muted, so don't worry, we can't hear you. You can only hear us. And if you do have any technical difficulties, there is a dial-in number available in your registration, and you can access the audio that way. So we want to take a second to thank our sponsors today, without their generous support, we would be unable to put on these webinars for folks. So we'd like to thank the Arthritis Society, Nicola Wealth Management, AbbVie, Amgen, and Sobi. A quick note that if you enjoyed this session, you can find many other sessions just like it available at cassieandfriends.ca. And this session will also be available for viewing within a few days on the website. We also have available at cassieandfriends.ca our classroom resources. So you can find information for about pretty much anything that you're looking for, from JAA 101 to biologics, nutrition, physical activity. It's all available for you on the website. So a quick second to look at who is in the room with us today. We have 80 attendees from 40 cities and towns in 3 different countries. So thank you all for joining us. And if you're like us, you know that there's not a lot of people that fully understand, day-to-day challenges of navigating juvenile arthritis. So we want to let people know to check out the Arthritis Canada Facebook page, where you can find other families just like us to connect, ask questions, and just find support. A quick note about some upcoming events that we have. Just to note that you will receive a link with a session survey and resources. Please do respond to that link after the session today. Your input is greatly going to help to meet your needs for upcoming events all over the country throughout the year. Check out to take a look and see where one is happening close to you. And we want to let people know that we have some upcoming virtual education sessions. The Ask the Expert Q&A session is on April the 5th. Our CRMO info session, April the 23rd. And we have another needle injections distraction technique training date coming up. Stay tuned. Lastly, just keep in mind, folks, that you can ask a question at any point in time in the Q&A box. We will take a look at those questions at the end of the presentations today and be happy to answer as many questions as possible. After the session, you can feel free to email email us questions at info@cassieandfriends.ca or visit cassieandfriends.ca. Please keep in mind that while we may not be able to answer every question today, we're more than happy to respond to you after the session if we were unable to answer your question. So a quick second to introduce our speakers. As I said, my name is Jennifer Heeley. I have my daughter here, Devin Nichols, who is going to assist us with the patient portion today. We also have with us Dr. Tara Mcgrath, a pediatric rheumatologist and pain medicine physician at the University of Alberta and Stollery Children's Hospital. Dr. Mcgrath is a pediatric rheumatologist and pediatric pain medicine specialist, currently working at the Stollery in Edmonton, Alberta. She completed her pediatric rheumatology training with the rheumatology team at BC Children's Hospital. And prior to this training, she spent a year completing a clinical and research training program in pediatric pain management funded by the Stollery Children's Foundation. Dr. Mcgrath has worked with many amazing kids with chronic pain who have come a long way in understanding their pain and making changes in their lives. She says that she loves empowering them with the education and tools they need to live the lives that they want. And we're very excited to have her with us here today. She's been a big hit at Past Family Days. So now we'll jump into the patient portion of the session. Devin is going to do most of it with just a little bit of a hand for me.
Okay, so hi everyone. My name is Devin Nichols. I am a 14-year-old from Amherstburg, Ontario. I was diagnosed with juvenile idiopathic arthritis when I was 12. Pretty much ever since my diagnosis, I've been somewhat involved with Cassie and Friends. They have provided me with a community that I'm very grateful for. And I also work with a nonprofit, Take a Pain Check, to help raise awareness and advocate about juvenile idiopathic arthritis. So I just kind of wanted to give a bit of a backstory about kind of the before my big flare-up and diagnosis. So I was actually a high-level competitive gymnast. I trained about 20 hours a week. I loved it. And this is just a video showing all I could do as of end of February 2020, kind of right before my big major flare-up that really led to my big diagnosis and journey and everything. Okay, so that's kind of just all of the crazy stuff that I was able to do before my big major flare-up, just kind of a summary there.
So, you know, when we look back as a family, it's really hard to tell where the arthritis started. There's all these little signs for us that maybe something was going on. So, you know, way too many injuries. Devin was the gymnast that was injured. She was the ever injured, way more than any of her teammates. And every asked questions about that. You know, why is this happening? What's going on? You know, what the answers that we got were she's training hard. She's a high-level athlete. This is just what happens. But my mama heart knew something just wasn't okay. In 2019, she ended up with whooping cough. And after that, she just couldn't get well. Even well after she should have been okay, she couldn't get well. Energy was low. She couldn't rebound. She was sick all the time with all sorts of random things. And I knew something wasn't okay. So we went to the doctor and I asked for blood tests, much to Devin's chagrin, because she hated needles and she was really angry at me for a little bit after that. You know, those blood tests didn't actually give us any answers at that time, though. And so, you know, we kept pushing on, but she wasn't getting better. Then she had a big fall on beam at gymnastics. And after that, her back was quite sore, which led to other scans that pointed out that maybe there was sacroiliitis for her. We were hopeful at that point in time. That meant that it was from her beam fall, even though we started seeing the links to arthritis. But the doctor put her on some anti-inflammatories at that point. And even after that, those anti-inflammatories, she still started experiencing joint swelling, which eventually led us down the path that we're on today.
Yeah. So this is kind of just the early stages of my disease onset and the beginning of my journey. So definitely, as my mom said, this was like at the very beginning of COVID. I was at home, so we can't really blame it on any trauma from gymnastics or overtraining, it was very confusing at this point as to why I was still having pain, and my joints just were starting to swell like all throughout my body, not just my back. Like my wrist started swelling, my fingers, my knees, and there was no reason for this. So this started leading us to possibly thinking, well, maybe arthritis. This is kind of like the beginning of it. And then following that, obviously there was pain and loss of mobility started, to the point where, like, at the beginning of the week, I was able to walk around the block with minimal pain, but there's still pain, but I was able to do it. And by the end of the week, I had to, like, my mom had to help me, just almost carry me by the end of the walk around the block because I just couldn't do it anymore. I was having trouble holding forks, squeezing shampoo bottles, using pens and pencils. And so, yeah, it was a really crazy time at that point, and it was pretty scary because we weren't really fully sure what was going on then. And we have a video here about 2 months later after you saw the first video of all the crazy stuff I was doing. This is about 2 months after, and it shows just like the drastic change in my mobility and quality of life. So yeah, that's still a bit of a hard video to watch even now. But yeah, as you can see, there was a very big change there for us. So,
and that was after she'd walked about 300 meters. So yeah, still difficult for both of us to watch that. So there was lots of steps on our journey to diagnosis. You know, when we look back, we can kind of say that there some definitive changes happening for her when she was around 10. There was back pain no one could find answers for. And we had a family doctor who, at the time, suggested to us that perhaps she just had mental health issues and it was all anxiety in her head because he couldn't figure out why this would be happening. So at that point in time, we determined it was time to find a different family doctor where we would feel heard.
Yeah, especially because I was like that kid. I loved school. I loved gymnastics. And it would make me more stressed to be sitting out than, you know, to be there. And so that it was just clear that he didn't know like me fully. So we decided to kind of make a change there.
And then after all these symptoms started happening for Devin, they started happening right after COVID started. So finally, nobody could blame gymnastics. So our new family doctor, who's fantastic, was quick to get us a referral to rheumatology and start all the necessaries, the blood work, the x-rays, the MRIs, all these things that are involved in testing. And we got our first rheumatology referral, and the doctor didn't do a full joint check and didn't, you know, Devin didn't have extreme swelling, so he dismissed it. And we talked to our family doctor afterwards and told her what had happened. And she said, no, we're going to get you to see somebody else. So we got a second rheumatology opinion and found a doctor that's really changed Devin's life and eventually diagnosed and started treating her. JIA, but you know what, trauma associated with that.
Yeah, and just like that fear of like, eventually it gets to the point where you're thinking, well, maybe it is in my head. And it got to the point for me, I was like, I do not want to see any new doctors. I was like really against getting a second opinion, which I'm glad I did, because obviously that completely changed my life now. But yeah, it was definitely a fear for me. Okay, so this is just of a summary of the medications for me that make a difference for me and my quality of life. So I started off at the beginning with just some basic NSAIDs. I started off with naproxen, but I actually ended up switching because it was just a bit too hard for me on my stomach. So I added in lansoprazole as like a stomach protectant, and I moved on to Celebrex, which now that I'm thinking about it, I think it actually worked well for me, but I was starting to experience dizziness, and we were hoping that was just from the medication. So we switched to meloxicam, which ended up working pretty well for me. And I actually found out later that Celebrex, the dizziness was not related to Celebrex, it was an iron deficiency. But yeah, unfortunately, meloxicam was not enough to control my inflammation. So we moved on to methotrexate injections. And I'm sure anyone, like I'm sure there's lots of people here who are on methotrexate. I'm sure you know that's a pretty big step at first, like just because you don't know that the science can affect people differently, and it can be scary just not knowing how it's going to affect you. So I started off with 15 milligrams. It did improve my quality of life quite a bit, but not quite enough. So we ended up trying a biologic instead. And another thing to add too, it was a big deal for me adding in home injections because, as my mom mentioned before, I hated needles. I would do anything to avoid them. So finding strategies to manage that was a big deal for me. So I started off with Humira injections weekly. And again, that improves things. Really, me, I thought that would actually be the path to remission for me. But unfortunately, I got an infection. I had to go on antibiotics. And then my body, my stubborn body, decided to produce antibodies against the Humira. So I had to move on to Remicade infusions, which I'm now currently doing. So I started off at every 8 weeks, and that was not quite enough for me. The last couple of weeks, I started getting swelling again. So we moved on to 6 weeks. And again, just like that last little bit, I started getting swelling again. At the beginning, it was working, but just not the last little bit. So I'm now doing switch 4 weeks for Remicade infusions, and I have a good feeling about it. I really do hope it works. So yeah, and then I also am taking vitamin D, B12, folic acid just to help with side effects, and a topical diclofenac just to manage any pain that I have. And I have found that it has been a huge part of quality of life for me and improving quality of life, managing my pain.
So part of our process as well was finding the right medical team. We joke that Devin saw every doctor within about 200 kilometers for a while there. So, this is just a bit of a list of the various people that were involved in Devin's care. As we moved through this, includes family doctor, rheumatology, pediatrician, a social worker, because the mental health aspect was really important for us. Gastroenterologist, optometrist, immunologist. We had both a injury physio and an arthritis physio, and the pediatric chronic pain team.
Yeah. So they're kind of just tips for coping with, chronic pain, physical pain that I've learned throughout my journey, because learning has definitely been a big thing for me throughout this. I've learned a lot. So one of the basic things, but like a big thing too, is using heat or ice depending on what feels better. I find usually for stiffness, heat helps more if it's not like super active inflammation, but it really just depends on what helps you the most. I also have found that ice just works better for extra swollen joints if it's like extra active inflammation. That helps the most for me. So a big thing for me, as I mentioned, I was a high-level competitive athlete. So, learning to listen to my body and knowing my limits was a big thing, because I was often praised for pushing through pain, and, pushing through pain makes you stronger. But as I learned throughout my chronic pain journey, that is actually not true at all, and that knowing your limits and being kind to your body and not pushing past them actually does end up making you stronger in the end, because if you push past them, it will end up worse for you in the long run. And following that, it's okay to have a rest day if you need it, and just to be kind to yourself. So this is a big thing I kind of learned in the past year as schoolwork has become more of a thing as I've gotten older. This is like a time management skill for me, is just do as much as you can for schoolwork on the good days, especially as you're getting older, because then on the bad days, you don't have to worry as much about behind or having to push yourself hard when you just don't feel like you can do it. So that's definitely helps with stress around that. And then a super big thing is just being open and honest about your disease and your limitations. So I actually, at the very beginning of my journey, I made a video just explaining like my disease and how it affects me and my limitations. And of course, it was really scary, you know, being vulnerable like that. But I found that when I did that and I put that out there on social media, I actually found I had way more supports than I thought. And it really made me feel a lot less alone and just more supported and less scared in this journey. And then this is kind of like my motto. I live by this. You know, of course, it's important to take care of yourself and know your limitations. But if you're going to be in pain, whether you're sitting at home or out and you have accommodations that you can use, then, you know, you shouldn't let your disease stop you from finding your joy, because with chronic pain, chronic illness, you know, you never know when there's going to be good and bad periods. So it's really important to just find your joy when you can. That's just a really big thing for me that I've learned. And then as well, motion is lotion for your joints. So on days, I try to do a little bit of movement as much as you can. Some days are easier than others, but just do what you can, because I have found that that's really helped manage my pain, especially when I have extra stiff joints and active inflammation. Just doing even basic stretches has really helped just manage that part of it.
And we wanted to really acknowledge that chronic pain is not just about the physical pain. I once heard it described as chronic grief, and that really stuck with me. You know, you hear it gets easier as you go, and it does, but that doesn't mean there aren't bad days, that there aren't hard days where you feel overwhelmed. And it's hard for people outside of the community to always fully understand, so it can feel really isolating as well, as something that we found. And there's absolutely major stresses involved with scheduling medical around school and work and trying to live that life while juggling all these appointments.
It's definitely a big thing for sure. So I just wanted to talk about the importance of community and what I've found throughout my journey. So telling people what is happening for you really is so helpful. Just being open and honest opens up so many supports, and it helps others to understand, which helps you feel less lonely. And also it may help you too, if other people are more educated and understand better, it may actually help you if you need accommodations in the future to just better be able to get them. And then this is a really big thing for me, is connecting online with others. So I found this a lot through Cassie and Friends. I will never forget my first event. This is like a big thing for me. At the end of my first Cassie and Friends online event, they said just to put your thumbs up for like an end of event picture so that they could post it on Instagram. And I noticed I wasn't the only one with a swollen thumb, which may seem small like to anyone else, but for me, it just made all the difference. I realized that I wasn't alone. Like I wasn't the only person that had this disease, and it just made me feel way less lonely and more normal, if that makes sense. So this is just kind of a little bit of a summary of what I learned from my journey through chronic illness. So like I said, setting limits and listening to your body does not make you weak. And I always thought that at the beginning. As a competitive gymnast, I thought pushing through was necessary to be strong, but that's not always the case. And that's definitely something that I've learned. Another thing, I am way stronger than I thought I was. And I'm sure all of you other warriors can relate to this, that, you know, if I can fight through this, I can fight through anything that I put my mind to. And it has definitely taught me to appreciate the little things in life, the good days, because you never know what's going to happen. So, you know, just really appreciate those good days, those hikes, because you never know what days are going to be harder than others. And the little things actually add up in the end.
And, you know, we used to celebrate medals, and then we learned that it felt no less amazing to celebrate a walk around the block or a good day.
So that was a big thing. And another thing I mentioned, I am a little bit of a perfectionist. So yeah, just a little. So a big thing was just realizing that I am worthy no matter what. I can, even if I'm not the perfect student, the perfect athlete, because at times, you know, you do have limitations and you can't be your like your best self every day, it changes. It varies day to day. And it really did teach me that people will love me no matter what I can do. And then last but not least, that while I may have limits and different limits than my peers, there are so many things that I can do that my JIA cannot and will not take away from me.
All right. Well, thank you so much, Devin. To say I'm proud of that kid would be the understatement of the century. That said, I'm going to take this opportunity to introduce Dr. Tara Mcgrath and let her take over the floor.
Awesome. Hi there, everyone. Thank you so much for sharing that, Devin, and your add-ins from your mom, Jen. That was, I'm the first one who gets to speak after you, so I can just say it was really, really awesome to hear your story, and I really appreciate hearing it. And I'm sure others other participants online here are very grateful for what you've shared as well. And it actually was a beautiful segue into the kind of the more medical focused talk that I will be doing, and it really has a lot of crossover into what I will be talking about today. So thanks for setting the stage beautifully. I will just do the nerve-wracking task of sharing my screen on Zoom here. So hopefully I will be able to do that successfully. And now I need to do presenter view. All right, I think I'm not sharing the right one, so I'm just going to try that again. Sorry. All right, can I get someone to confirm that you're seeing just the PowerPoint slide?
Yep, you're good.
Okay, awesome. Thanks, Devin. Okay, so you're just seeing the full PowerPoint slide and not a weird black screen with writing on it, correct?
Yep, everything's all good.
Awesome. Thank you. I appreciate your backup. It's hard when you're speaking into a void of silence to know if there's any glitches, so I appreciate that feedback. All right. I just want to say thanks for that introduction, Jen, and thanks for the opportunity to present this evening. Thank you to Cassie and friends. As has already been said, I'm Tara Mcgrath, and I'm a pediatric rheumatologist and pain medicine physician in Edmonton, Alberta. And prior to completing my pediatric rheumatology fellowship in Vancouver, I did spend a year studying with the pain team in Edmonton at the Stollery. And I also spent time during that year learning from pediatric pain experts in Bath in the UK and also in Sydney, Australia. And this artwork that I'm sharing here was done by a patient in our chronic pain clinic, and I do think it is very beautiful. So I had her permission to share it today. Perfect. So before we start here, I just wanted to get some info in the chat box, just a little bit of, I guess, sharing here. If you could just let me know what disease affects you and your family, just so I think it would be predominantly JIA, just based on the general population of rheumatologic patients, but I think there's probably others in the audience as well, and I'd love to see the diversity of what rheumatologic disease affects you or your child or your family member, the reason that you're here today. So just let me know. I'll have a quick look at the chats here. So I'm just scrolling through, just giving everybody a chance to answer. And I'm seeing that there's a lot of patients with different types of JIA. And then there's also some autoinflammatory diseases. I saw lupus, CRMO, linear scleroderma or morphia. So I'm very, some varied, and we have some fever syndromes, VFAPA, so all an ankylosing spondylitis. So again, following kind of along similar lines to the ERA type of JIA. So feel free to keep adding them in, but I've kind of got a good sense of the variety here. So thank you so much for sharing that. Looks like we have GIA and history of osteochondromatosis and lots of different things. So thank you so much for sharing. And we have systemic GIA as well. So thank you very much, everyone. And that will just help me to kind of tailor my talk a little bit, because I do talk about pain and GIA, but also other rheumatologic conditions. So I'm happy to do that. All right, so this next slide is a quote, and this one's actually for the parents or caregivers on the line if you're there. This quote is actually, I don't know who said it, so if you do, please message me and then I can properly reference this. It says, no matter how old our children are, when they hurt, we hurt. So if that resonates with you and you're a parent or caregiver on the line, or even if you are, I think there's a few kind of staff in rheumatology, if that resonates with you around your own children, even with different types of pain, not necessarily inflammatory pain, let me know if that speaks to you. And if it doesn't, that's totally okay. All right, I'm getting a few yeses in the panel here, or in the chat here. So with that, I'm just going to move on. So let you know what the goals of my talk is today. So I want to look at pediatric chronic pain, specifically in rheumatologic diseases, and my background helps me to do that because I've been able to wear those two hats, both in rheumatology and in pain. And I want to discuss the biopsychosocial model of chronic pain, as well as explore management strategies for children with chronic pain. And at the very last slide, I'm going to make sure that I provide some tips and tricks for both kids and families for managing chronic pain. So first off, I think it's important that we define pain. So pain has a purpose. Think about when you accidentally touch a hot stove or you have a pointy rock in your shoe. Pain is also a protector. By making unpleasant sensations, our brains change our behavior, and this prevents injury and allows healing. This is important for keeping us safe and healthy. Many people online on this link today will have experienced a broken bone or a serious sprain or a strain of any kind. So the pain signaling from your brain alerted you that the bones and tissues were injured and you needed to stop. This is helpful because you need to stop putting full weight through the injured area and rest to allow time for it to heal. If you kept using or walking on a broken bone, you may injure it further, making healing more difficult. And a good way to highlight the utility of pain is to consider when someone loses pain sensation entirely. So a good example of this is diabetic neuropathy. And this is when an individual loses feeling, usually in their feet, as a complication of diabetes. The main problem people get when they have diabetic neuropathy is that they get wounds, and often these get infected. So these individuals are prone to injuries in the skin that progress to developing into wounds because they are missing the pain signals to tell them early on when they are at risk of getting a sore. So moving forward here, I'm going to show you a few cringy pictures. So if you are particularly sensitive to seeing cringy things, or someone that's watching with you is, then just get them to look away, because these are some cringy photos to just kind of get my message across. So viewer discretion is advised for this next little bit here. So in certain circumstances, warning signals can be activated by non-physical stimuli, such as thoughts and places. So pain can be stimulated without a physical injury. For example, seeing someone get injured. Think about what you're feeling when you see this or this. Another very common example of feeling pain without a physical stimuli is headache. So let's think about headache here. Can anyone who's got, it can write in the chat there, anyone who's got quick fingers, write in some things that trigger headaches. Headaches are very common and lots of people have different triggers. So if you can write in the chat what you have noticed or heard from other people triggers headaches, I'll have a look here. Yeah, so we've got dehydration, stress, screens, sun, loud noises, your underlying diagnosis. Yeah, lupus, crying, fighting with someone, all awesome answers. So thanks for sharing that. So certainly trauma, like if you get hit in the head, like a concussion, or a more minor head trauma, can definitely trigger pain, which is a physical stimuli, but so many other things can as well that are not physical. For example, different foods, stress, fatigue, and all of the other things that were listed in the chat. So thanks for sharing those. So in some patients, pain persists beyond the expected healing time, which is arbitrarily defined as greater than 3 to 6 months and develops into a chronic persistent pain. Chronic pain can occur from an underlying health condition such as rheumatologic disease, or chronic pain can develop without an underlying diagnosed condition. In chronic pain, the nervous system starts producing unnecessary warning signals. Pain goes from being helpful to unhelpful. Think about phantom limb pain. So this is when a person continues to have the sensation of pain in a limb after it has been amputated. So is this pain useful? Definitely not useful. You don't have a limb there anymore and you're still having pain. But is this pain real? Absolutely, for sure. 100% phantom limb pain is real. So why does chronic pain happen? So pain scientists are now starting to understand that the pain system can become overprotective. For example, I have a smoke detector in my house that goes off when I'm making toast, not even burning toast, just making toast. And with that, it's the role of the smoke detector is to protect my house from burning down, but it's going off too frequently and it's super annoying. I do need the smoke detector to stay safe, but it's so oversensitive that it's not helpful to me anymore. How does this overprotectiveness happen? Well, our brains can become conditioned. So a classic example of conditioning is Pavlov's dog experiment. So many of you would have heard of Pavlov's dog experiment. It's brought up in school in different scenarios lots of the time, but I'll explain it to you. So Pavlov was a physiologist, and he noticed that when he placed food in front of his dogs, they started salivating. He started to ring a bell every time he served the dog food. And eventually, if he rang the bell alone without serving the food, the dogs would start to drool. So the dogs' brains learned that when the bell was rung, this equaled food. So this is called conditioning. And this actually happens in humans as well. So this means that your brains can begin to produce persistent pain without a physical stimuli. So in other words, and this has been shown in pain research, our brains can learn pain. And the longer it produces it, the better it gets at producing it. And in these cases, pain can start to spread to involve larger areas. Old areas of pain can become reactivated, and it can be affected by mood and thoughts. So this is why specifically chronic pain is important consideration in rheumatologic diseases where pain is common. So what do we know about pain and rheumatologic diseases in children? So the most robust pain studies have been done in children with JIA. Pain is a distressing and prevalent feature of JIA and can severely impact children's quality of life. It has been described as the most distressing component of the disease. Even though we are getting better in rheumatology at treating inflammation, kids with JIA are still having pain. Why? Well, it's complicated and we don't fully understand this. And I will speak more about this later, but it may have in part to do with the development of chronic pain in some children. So in terms of other rheumatologic diseases, there is less research into the pain experience. I didn't see if anyone in the chat wrote that their diagnosis was juvenile dermatomyositis, but in this diagnosis, children have pain from arthritis and also muscle pain and painful skin lesions. In lupus, children can have arthritis, muscle pain, pain from inflamed lining of the heart, lungs, abdomen, headaches, and painful skin rashes. And then pain is also prominent in other rheumatologic diseases, including vasculitis and Behçet's, definitely in CRMO and periodic fever syndromes like PPAPA that was mentioned in the chat, and then kind of the undifferentiated autoinflammatory syndromes that were put in the chat as well are definitely fall under all of these categories as well as being often quite painful. So in summary, rheumatologic diseases are caused by inflammation, and this is painful. Pain affects day-to-day activities, participation, and quality of life in affected children. So why is chronic pain more complicated in rheumatologic disease? Well, rheumatologic diseases are chronic diseases that are prone to flares of inflammation. Some children and adults with prolonged or recurrent pain from inflammation are susceptible to developing chronic pain, which is pain that occurs even when the inflammation is controlled. Inflammation is an important pain trigger, but it is only one piece of the puzzle in a child's pain experience. This experience can evolve and change over time, as can the course of rheumatologic disease. So this makes it extremely complicated. So let's look at the current science of pediatric chronic pain. Now, from my explanation earlier, I hope that it is clear that chronic pain develops from the nervous system becoming overprotective. So this is because of changes in the neurobiology within the nervous system. And this is a biological process, otherwise termed central sensitization. And recently, there has been significant research in this area, especially by Clifford Wolf, who's a professor of neuroscience at Harvard. So central sensitization is described as amplification or loudening of nerve signaling within the nervous system that causes pain hypersensitivity. This means pain in response to a stimulus that would not normally elicit pain. For example, a light touch or a mildly painful stimulus like a pinprick causing severe pain rather than mild pain. So it gets even more tricky than this. I mentioned earlier that a person's mood can influence their pain experience, and here's why. The modern day biopsychosocial model of chronic pain experience is the most widely accepted approach. Bio means the biology, psycho means the psychology, and social, well, means social. And this approach views a physical disorder, so we're talking about a physical disorder, in this case chronic pain, as the result of interaction among biological, psychological, and social factors that mix to create the chronic pain experience. You can see here listed examples of the many players involved. I just want to emphasize here that chronic pain is not a psychological or mental health disorder. All of these circles are playing together to influence the physical experience. Okay, so now let's move on to management. Given the many layers of chronic pain, it makes sense that that management is multi-layered as well. So the 4 key treatment considerations I would like to discuss are 1, treating inflammation, 2, increasing physical activity, 3, promoting mental well-being, and 4, improving sleep. So rheumatologic diseases are disorders of inflammation, as I've stated. In rheumatology, we know that the key player in controlling inflammation is immune suppressing medication. It's important to work with your rheumatology team to find the right treatment plan for your child's disease. This may be quite straightforward or very complex, as each person is different. Also, it's not always easy to find the best medication treatment or a combination of medication treatments, so this may take time. Physical activity and physiotherapy. So many of you will have worked with a physical therapist and possibly also an occupational therapist team, as physiotherapy, including rehabilitation and strengthening, is a key player in managing rheumatologic disease. But beyond this, it's important to know that there is clear evidence of specific physiotherapy targeting the management of chronic pain, involving active treatment and setting child-led functional goals. Part of the focus of this physiotherapy involves retraining the brain as to how to respond to the overprotective pain signals. Okay, now there is compelling evidence that children with chronic pain are at risk of having or developing mental health conditions, most commonly anxiety and/or depression. Chronic pain can increase the risk of having a mental health condition, while having a mental health condition may predispose to having chronic pain. So I want to do a little exercise now. I'm going to move to the next slide here. And so this is not a crossword puzzle. This is a word search, and it has actually 18 words in it. So what I'm going to challenge you to do is, anyone who is watching now, you can decide how you want to, how you kind of want to look for the words if you are more than one person on the other side of the screen. But I'm going to get you to start looking for words. I'm only going to give you 1 minute to find for as many, they're not easy words, as many words as you can find in 1 minute. But there's also going to be some audio that comes on. So if someone in your room is like you, or a pet is really sensitive to noises, just maybe mute. But for the exercise to work, you do need to have the audio on. So I'm going to give you 1 minute to start looking for words in the word search, okay? All right, so I'm just going to pull up the chat here, and it looks like we've got some good words found here. Oh yeah, we've got lots coming in. Perfect. Okay, awesome. Okay, just trying to get to the next slide here. Okay, so thanks for sharing all of the words you found. Now, actually finding which words you found is actually not the total point of my demonstration or exercise here. What I would like you to do now in the chat is comment how you feel like the audio of the car alarm impacted your ability to find the words that you were looking for on the word search, if at all. All right, we've got some stress, distracting, very impacted. Yeah, stress for sure I'm seeing. I'll just give you a couple more seconds to add in. We've got some anxiety. Yeah, like time's running out. For sure. Anxiety inducing, for sure. Felt terrible. Definitely did not help. Awesome. So thanks for everybody sharing. I know not everybody has enough time to add in the chats there, but I do appreciate those people that added in as they could. So that demonstration or that exercise of trying to do a word search while there's a car alarm audio playing, is that this can be what it's like trying to get through life with chronic pain. So these feelings that you've written, the stress, anxiety, distraction, all of those things are very understandable. To have a constant protection or pain alarm sounding in one's brain is very frustrating and exhausting. It's stressful, worrying, and scary to constantly be told by your brain that you are in danger. So when you want to participate in school and sports and see friends, but your body is telling you that to do so would cause harm, this is understandably going to bring your mood down. Additionally, as mentioned earlier, the lower a person's mood or the more anxious they are feeling, the louder pain signals get. So it's a vicious cycle. This is key for all of us to understand. Chronic pain is not caused by depression or anxiety. However, children who already have these disorders are at higher risk of getting chronic pain and children who have chronic pain are at higher risk of developing anxiety and depression. So psychological intervention is important to help treat the depression and anxiety symptoms that may be pre-existing or developing secondary to chronic pain, which helps break this cycle. But additionally, and I would argue perhaps most importantly, there is very good evidence that psychological interventions, including CBT, which is cognitive behavioral therapy, a type of psychology therapy, it actually effectively treats chronic pain. So this is another key part of the retraining of the brain. This involves many strategies, including biobehavioral relaxation exercises and mindfulness. Now let's talk about sleep. So fatigue and poor sleep influence a person's pain experience. If any of you have had the misfortune of staying up for more than 48 hours straight, you will know that sleep deprivation makes everything hurt. So people who sleep less have more pain. Okay, so that was a lot. Let's go through a summary to look at the summary, but I just want you to know that a key step to managing chronic pain is understanding it, which is why I've spent all this time kind of doing discussion on what pain is. So in summary, pain is a protector. Sometimes it can be overprotective. Children with rheumatologic diseases have a significant burden of pain symptoms, and some children develop chronic pain, which can persist despite good inflammation control. This pain is not just in their head. This pain is real and is from a dysfunction of the pain system itself. All right, so I'll start here with another quote for caregivers or parents in the room here. So in the virtual Zoom room, the hardest part about being a parent is watching your children go through something really tough and not being able to fix it. So unfortunately, the reality of the current state of pain science is that we don't have a quick fix for chronic pain, but we do see the benefits of effective management strategies in helping children lead more active and meaningful lives. So now I'm going to highlight some tips and tricks for you as kids, young adults, and parents. So my first tip is to work with your rheumatology team to find the best medication. Do your best to promote healthy eating and make it a family affair. Practice good sleep hygiene. So these are good sleep habits, and this involves sticking to calming, regular nighttime routines, avoiding screens and caffeine at the end of the day, and using other strategies. Next is to work with a physiotherapist for the reasons that I already mentioned. And beyond this, also, Devin spoke to this very well, there's a very well-known physiotherapist and pain scientist out of Australia. His name is Laura Mosley, and he has that famous quote that motion is lotion. And that is very true for chronic pain, and Devin mentioned that. So highlighting that as well. Next is to encourage stress management. Also, get mental health support. Don't be afraid to ask for help with mental health struggles. Talk to an expert, whether that be a psychologist, mental health therapist, not only for anxiety and depression symptoms, but also that they have actual treatment strategies that can help with pain management itself. All right, moving on here is demonstrate positive coping. So focus on what is possible as an entire family instead of what isn't. Next, I have learn mindfulness. So this is a practice or skill involving noticing when we are caught up with worries about the future or regrets of the past and bring ourselves into the present moment. All right here. And then make positive changes a family goal. And also anticipate setbacks. Pain relapses are part of this disease and are unfortunately part of many rheumatologic diseases as well. So flexibility and setback planning can be helpful. All right, and this last one is actually for support members, so family members and parents and physicians, allied health that are on the line. Believe their pain and cheer them on. So another message to caregivers and parents here, your role as parents and caregiver is absolutely central to your child developing and maintaining these management strategies and improving their pain experience. So give yourself credit for all that you do every day to help them cope with their challenges. And I'm sure there are many young people on the line here that have lots of pain that are already doing a lot of these things. And I also want to commend you for all the hard work that you're doing. And also as an aside here, there are a lot of resources on the Cassie and Friends websites about almost every one of these hexagons. I want to make sure I say the right shape, hexagons. They have some great resources there. So if you're feeling like you don't know where to start, that's a good place. I also have some resources for you as well. And then for the caregivers in the crowd, an important reminder is that self-care, and also for young people as well, self-care is not selfish. So this is a quote by Eleanor Brown: "You cannot serve from an empty vessel." So a great way to promote self-care in your child is to exemplify self-care yourself. And that is the reason that in safety demonstrations on the airplane, you must put on your own oxygen mask first. So for parents and caregivers, I do have these two books that are, I would say, are highly recommended for anyone who has chronic pain or lots of pain for various reasons, including rheumatologic diseases, Managing Your Child's Chronic Pain by Palermo and Law, and also When Your Child Hurts by Coakley. There's also two really cool, not too long YouTube videos that really talks a little bit more about what I was talking about in terms of chronic pain and central sensitization. One is called Understanding Pain in Less Than 5 Minutes and What to Do About It. And another one is by Lorimer Moseley. If you look him up on YouTube, he has a lot of cool stuff talking about pain. He is an expert in the field. And this one is called Tame the Beast. It's Time to Rethink Persistent Pain. And if you have family members or friends that you feel are having a hard time understanding your pain, these are good videos to show them as well. These can be shared, these resources can be shared with you after the talk as well, of course, but here are some websites that I would recommend in terms of pain management. And I've also put some mindfulness apps that I or my patients with pain have used and found helpful or useful, and some of you may use these already. So to finish off here, this is another piece of art that was drawn by a young person in the chronic pain clinic that I work at. And she writes, "Just like how a flower is told it can't grow through pavement, pain tells me I can't do a lot of things, but like the flower, I know I can't." So that is it on my end. I will unshare my screen. Thanks so much for having me. And I think we'll have our question period here. But I'll let Jen lead the way through our next steps.
Thank you so much, Dr. Mcgrath, for all of the information you just provided. Actually, Devin and I are sitting here, even though we've heard the presentation before, on the sidelines saying, yep, sleep made a difference. Yep, mental health strategies made a difference. And I can tell you I've read both of those books and they were incredibly helpful. So we will now move to the Q&A section of the presentation. We want to just remind people that you can enter questions at any point in time down in the Q&A box below, and we'll continue to move through them to make sure that we get as many questions answered as possible for folks. And you can continue to enter questions throughout the Q&A period. So we're going to start off with a question that I'm going to send over to Dr. Mcgrath. And it's, what's the role of physiotherapy and exercise therapy in JIA chronic pain management?
Awesome, great question. And I hope I spoke to that a bit in my talk, talking about the importance of physiotherapy. So physiotherapy is important in JIA and other rheumatologic conditions in general. There is good evidence that physiotherapy can help improve range, strengthening, and pain in terms of that perspective of things. There's also definitely a significant role for physiotherapy in chronic pain when someone has developed that central sensitization phenomenon that I've talked about. It is, we in our chronic pain clinic, we have a physiotherapist and they do amazing work with our young people, and there are many community physiotherapists that are experienced in treating central sensitization, and it is a key pillar in treating this type of pain as well, especially its role in kind of retraining the nervous system and kind of desensitizing and that sort of thing. So I think I addressed that in the talk, because that was one sent in, I think, from before the talk, but happy to elaborate on that if there's any further questions.
Okay, thank you so much. So I'm going to send the next question actually over to Devin. Somebody has sent in that it feels like chronic pain from JIA and lupus has taken my daughter's life away. Will she ever be able to lead a fulfilling life again? What are your thoughts on that, Devin?
So I can completely understand where you're coming from there, because I have definitely thought that I've asked myself that same question a lot as someone who does have JIA and chronic pain. But I can definitely say that while it is a journey and, you know, it's definitely progress is made over time, that absolutely you can live a fulfilling life again. I promise that while it may seem at times like it is hard, that there are resources and people are there to help you just be able to live your best life. And while there may have to be accommodations or changes made, I can confidently say that I'm happy and that I feel that I have been able to live a very fulfilling life. So it is most definitely possible.
And to follow up to that, Devin, another question that came in the comments is how long it took you to get into remission.
So unfortunately, I still am not quite in remission yet. That is still a journey for me, but I do hope to get there soon. And I'm feeling pretty good about where I am now. Even if I'm not quite fully in remission, I definitely feel that, you know, my quality of life has improved. And for me, the main goal is quality of life and just being able to live my best life, even if I'm not fully in remission. So.
And, you know I can say as a parent, that's been one of my biggest worries throughout, because certainly, you know, she was on a different path before that was highly influenced by athletics. And so it was a huge change. And I was concerned about her mental health. I was concerned about her living a fulfilling life. And what I've learned as time goes on is, you know, the focus may have changed, but her abilities don't change, that she's still an athlete. She's still a great student. She still has friends. And for me, from the parent aspect, it's been learning to let go and let her help to steer what is and isn't okay. Not setting limits based on JIA that she wouldn't set for herself has been a huge learning for us.
And while fulfillment may look different than how it did prior to your disease, it still can be very fulfilling. Just that may change, but still in just as a fulfilling way, I found I've been able to have a very fulfilling life, even if that means, you know, celebrating, being able to go for a 5K walk. It's all about changing your mindset, but it's very possible.
Is there anything you would add to that, Dr. Mcgrath?
I would really just echo what you said, Devin. It can be really, really hard when you're feeling so down with comparing where your life was before, especially you know, things that were like for you, Devin, like things that were so central to you and part of your, how you defined yourself are so significantly changed because of your pain. But I can say, obviously, Devin has come so far in managing her pain, and I have really seen that in rheumatology and in chronic pain, that it can be frustrating, especially at first when the pain is confusing and you're looking at inflammation and also possibly sensitization. But once, I think if you can kind of get all those pillars together and work with your rheumatologist, try to get a physiotherapist and kind of your body moving, and try to get that kind of brain retraining with a mental health therapist, there's a huge potential for improvement in terms of pain experience, and also just really goal setting and you living the life you want to live. And also have a helpful school too. Yeah, so engaging your support system, and Devin spoke really well to that too. That looks different for everyone, but I would say there's 100% hope for you in terms of, and your daughter, for living a fulfilled life. And I think I cannot say it better than Devin. So I just say thumbs up to what she said.
Thank you.
So we'll move on, and I'll send the next question over to Dr. Mcgrath. At what point is pain considered chronic?
Yeah, so that's a great question. So in the pain science world, it's arbitrarily defined as chronic pain if it's lasted for more than 3 to 6 months. And that's kind of, it's arbitrarily defined, and that's just based on kind of when we research pain, setting a time that it seems like that sensitization starts to play more of a role. So for our purposes in pain medicine, we generally say 3 to 6 months. But often the people that I see with chronic pain have had pain for a very long time. And then inflammation pain and arthritis can be chronic, but it also can be like waxing and waning acute flares. So lots of pain for a couple months and then no pain for a couple months. So it definitely depends on how your underlying disease is affecting you. But arbitrarily, chronic pain is about, the term is used when pain's been lasting for more than 3 to 6 months.
And kind of a follow-up question to that, Dr. Mcgrath, we had somebody write in explaining that their child has been diagnosed with issues waist down, but they're having pain in lower back, wrists, feeling it in other areas. So they're wondering, typical that pain can present in other joints, even if, you know, they aren't in a chronic pain situation, even if they aren't necessarily diagnosed rheumatological areas.
Yes, that's an excellent question, and that comes up more often than you would think, I think, in a rheumatology clinic. So certainly it is possible for your rheumatologic disease, your JIA, to start affecting other joints in your upper body. So as with my rheumatology hat, I can say, yes, you can get polyarthritis that affects other areas. And so definitely, I think you need to discuss that with your rheumatologist, because sometimes it's hard, especially if it's a new pain, it's hard to distinguish, obviously, what if that pain is indicative of central sensitization or chronic pain, or indicative of inflammation. So physical exam can be really helpful and talking to your rheumatologist and talking about different things that make your pain better or worse can really to help clear that up as to whether it is inflammation pain that's spreading, or if it's chronic central sensitization pain that's spreading. If your rheumatologist doesn't think that it's inflammation, absolutely, I see patients that have only lower limb arthritis and have pain that's not arthritis, that is very severe and affects their function in their hands. So absolutely, that is seen and happens as well, and is related to having pain so long in other areas for a long time, and kind of how your body's learned pain. So it's not always clear, but that would be my thoughts. Certainly it's possible that it's arthritis, and certainly possible that it's other things that are contributing to the pain experience, including central sensitization.
Thank you for kind of making that clear. So I guess our next question I'll send over to Devin. People are asking if you're able to continue with gymnastics at this point, and maybe you can talk a little bit about the sport involvement you do have as well.
All right, yeah. So that's a great question. So I kind of have made my own kind of decision for me, just because of the level I was at. I was training really, really hard at the time, and I just found for myself that that might not be the best idea for me. However, I still love gymnastics very much, so I have gotten involved in coaching and training, starting to learn how to coach gymnastics so that I can still be involved in the sport. And as far as athletics go, I am I'm starting to become a part of my school track and field team, because I also really like track and field, and I found that that's a bit easier on my joints and a little less intense, but still makes me very happy, and I have a lot of fun with it. So as far as athletic and sport involvement now, that's kind of still a little summary of what I'm doing.
Perfect. Thanks, Devin. So I'm going to combine a few questions for this next one that I'll send over to you, Dr. McGrath. So what role does puberty or age play in the feeling of pain and managing it? And second to that, do males and females feel pain differently? You know, is that going to change for people with age, and what does that look like?
Awesome questions. Yeah, those are super great questions, and are totally questions that the pain scientists have been asking in the field. And so we do know that puberty definitely affects your pain experience. Our chronic pain clinic, for the majority, is mostly young people that are around the age of puberty or afterwards. We don't totally understand the details of why, but so far there are studies in terms of hormonal changes that do influence your pain experience, and that central sensitization, hypersensitivity, and how that comes to be in individuals. So absolutely, puberty does play a role, and it's more common to have a worsening pain experience or a more widespread pain experience at the time or shortly after puberty. And then in terms of kind of males versus females, they're also, I mean, that's also a little bit of a hormone question. So we also do know that males and females are at different, so I guess I'll start off by saying every person's pain experience is different. So if you lined Devin up with all of the other people that she's met with chronic pain, they would all have a similar story, but it would have different nuances. And so pain is an extremely personal experience. And so every single person's pain experience is different, even if they're the same age and gender and all of that. So in terms of males versus females, there is good evidence in the literature that chronic pain or hypersensitization, pain amplification that I've spoken about today, is more common in females than males. So for the most part, we see that about 3/4 of the patients we see in the chronic pain clinic are females. Chronic pain is a real documented phenomenon as a male. So I don't want you to think that if you're a male and have chronic pain that is different. It's just that in terms of risk of getting it, and I think it does have to do with just different, it's so multifactorial, but it does have to do a little bit about kind of with hormones and that sort of thing. It is more prone, you are more prone to it as a female, but definitely can get it in both sexes.
Perfect. Thank you. So I'm going to send the next question over to Devin. Somebody noted that we had immunology on our slide and asked how that played in your arthritis journey. Devin, do you want to explain that piece?
Okay, it's a good question. So we're still kind of figuring this all out, but I have been experiencing a lot of random periods of hives, as well as I've also experienced vomiting along with that and some other symptoms like that. So we're just still doing testing to figure out if that is somehow related to autoimmune, or if that's related to something else, like possibly like mast cell activation syndrome. We're still trying to figure all that out, but that's a great question. And yeah, just still figuring that out, but so far we're just doing testing because of some hives and symptoms related to like allergies and stuff.
Yeah, what we've found is that these things all seem to happen more with flares, but it's not necessarily arthritis related. More part of her chronic pain journey, so to speak, because certainly hives create discomfort, the vomiting creates discomfort, and we're still figuring all those pieces out.
Yeah, so still figuring it out, but thank you for the question. Great question.
So I'm going to send the next question over to Dr. Mcgrath. There's been some questions in the chat specifically around how to best manage pain while you're still seeking the right treatments, the right answers, the right diagnoses, and how, some strategies you would suggest to manage that. Some specific questions around the use of gabapentin for use of pain management as well.
Yeah, awesome question. Part of kind of what I talked about is, it becomes clearer when inflammation is under control. And if you still have pain, then that kind of fits more with this central sensitization. But what if you're not at that spot? What if you're still experiencing lots of pain and inflammation isn't under control or diagnosis isn't clear? So in terms of that, pretty much every tip and trick that I put on that slide works for any type of pain and can be used while you're still seeking a diagnosis or cause for inflammation. So it's still beneficial to see a physiotherapist as long as they know what your symptoms are and do a full assessment. They can still be beneficial in kind of strengthening and also doing some light range of motion and things like that, and getting you moving, because movement is still very helpful in cases where the pain is still not quite, the source is still not clear. Improving your sleep, eating, promoting healthy eating in your life, having psychological support, because having that much pain, even though, especially because you don't know the cause, is really hard and frustrating, and can trigger anxiety and other things. So all of those things that I had recommended as kind of pillars to treating chronic pain, you can actually activate all of those while you're still trying to figure out the diagnosis. And as you go along your journey, kind of pulling in that support team and using those resources can be very helpful. It's hard to speak specifically on medication because I don't know the full specific details of that case, the question of whether or not gabapentin is used in chronic pain. So gabapentin is used in something called neuropathic pain, which is a nerve pain. And it is used in some cases in chronic pain. In children, it's not commonly used, but it can be used in people with chronic pain, and it can be helpful for some individuals. It kind of depends on the nitty-gritty details of the pain present of I think it was, you're talking about your child's pain experience. So I obviously can't speak to the details of that, but it can be helpful for it's used in adults and can be helpful in young people with chronic pain as well. But in addition to the medication, I think getting that whole support system from all the because pain is so complex, bringing in the psychology support and the physical activity as well as the medication tends to be most helpful from my experience.
And certainly for us, speaking from personal experience, some of the biggest, because as you've probably figured out, we've got the juvenile arthritis portion down, but we're figuring out some of the other pieces to her puzzle yet. We don't have all those answers.
Yeah.
So some of the things that have made the biggest difference is the sleeping habits was a big one for Devin, that the chronic pain team really helped her with.
Yeah.
It changed her experience significantly when she was able to sleep.
For sure. And that was a big thing for me, was I found definitely incorporating a proper sleep routine really did help my chronic pain experience, because when I didn't sleep, my pain got worse, but then because my pain got worse, it affected my sleep, and it was a vicious cycle. So yeah, that was definitely a big thing for me. Yeah.
And honestly, it's something that I think some people are hesitant about because of the stigma, but I think one of the other biggest pillars for Devin was the mental health support, to be honest and frank, because you're working with the mental health aspects of dealing with chronic pain, as well as the grief of the fact that this is what you're going through. Your life has changed, all those aspects, and having a good therapist in play has made a world of difference. I tell anyone that'll listen that it's the difference between this amazing kid you see sitting next to me and a kid that was struggling so hard before is having that therapeutic connection.
And that's not to say too, I don't like not struggle still, because of course I do, but having strategies and learning strategies to manage it definitely it makes a big difference for me, for my journey. It's definitely played a big role in that.
And so we'll move to one last kind of follow-up question, and it's related to acupuncture or alternative therapies. So Dr. Mcgrath, do you find that those are often used in chronic pain management and can be helpful?
Yeah, great question. That comes up a lot as a question, and I am very happy to chat about that. So in addition to the kind of those pillars of physiotherapy and movement, medication for controlling inflammation, and potentially other medications depending on the team that you're managing, and also kind of the mental health, your psychology, and kind of supporting that as being those three pillars, which also goes with sleep and what you eat and all of those things. I think alternative or complementary therapy can be very helpful for young people with pain. I think in terms of specifically for GIA pain, I don't think there's specific evidence for acupuncture improving inflammation. Rather, but that being said, everyone's pain experience is different, and if it is this chronic pain central sensitization picture, some people do find that it's helpful. Some people do find that it triggers their pain though. So I think it's a very individualized and it's personal experience. And I don't think in terms of acupuncture, as long as you're going to someone who's certified and understands your diagnosis, I think that as long as you kind of pursue it safely, it's reasonable to try. But I don't think and if it works for you and it's helpful, using it is a very reasonable option. If it doesn't work, or if it makes things worse, that doesn't mean that there's anything wrong with you. So I think that everyone kind of follows their own path in terms of that. And I do have patients that find it really helpful. And I've had patients who say it absolutely doesn't help. So it has to do, I think, with your own personal experience and kind of your pain experience within your body. Massage, a lot of people have found helps with pain, but also relaxation and sleep. And so that's something that can be helpful. Lots of people benefit from, but some people also really don't like because they find that it makes their skin more sensitized. So it's a totally personal experience. Diet. So in terms of rheumatology and also in chronic pain, there's not, I see a comment about gluten. So in terms of whether there's a specific association with gluten and JIA, that's a huge question. There isn't clear evidence that we as Canadian rheumatology physicians are recommending that people who have arthritis go off gluten, but certainly there's good evidence of eating varied kind of Mediterranean style diet that's rich in omega-3s. There is some evidence showing that omega-3s can be very, very helpful with arthritis as an adjuvant to what you're already doing with your rheumatologist. So eating foods, especially incorporating into your regular diet. If you make adjustments in your life based on maybe gut symptoms that aren't related to your arthritis, then I think that's totally fine. It's you and your family's journey. And if you find that cutting out certain foods is helpful, but I don't think that everybody on the line here needs to be cutting out certain things. It's a personal journey based on what fits best for your life and your pain. And so kind of from that point of view, I would say that it is a bit of trial and error in terms of your own personal experience and finding what works for you. But overall, trying to eat a Mediterranean type diet high in fresh fruits and vegetables, high in omega-3s, and low in processed foods and simple sugars can be helpful in the overall pain experience because you can feel more energized and better when you're eating less processed food. That's a whole other talk about a diet. So I will leave that to a dietitian who has expertise in that for another session. And I know we've had some dietitians speak before. So I think there's probably resources online to speak to that a lot, because that's a whole, we could talk for a long time about that. And I'm not a dietitian, so I'm not an expert in that. but I'm just kind of speaking from my general experience from chronic pain and rheumatology.
And Dr. McGrath, you hit the nail on the head. There is a whole other webinar that speaks specifically to nutrition. So if that is of interest to you, please do check out the website. So unfortunately, that is all we have time for today. But please do know if your question did not get answered today, we will send out email responses. And also just a quick reminder to folks that we have on April 5th, a Q&A live session where any of your questions that may not have been answered today can be put forward to our experts. So we would just want to take the time to thank everybody that joined us today. Dr. McGrath, Devin for sharing her experiences, and all the attendees as well. It's because of all of you that we can make these sessions happen, and they're so valuable. So thank you so much. Please keep in mind this webinar will be available for viewing in the next few days over the website, and there will be an email sent out that lets folks know when that is made available. Also, just a quick note that if you found this presentation valuable, we are run completely on donations. We are a nonprofit, so there are many ways, including our Cassie and Friends Runs and Walks, as well as on our website, that you can choose to donate to continue to assist us in our goal of finding a pain-free future for all kids affected by rheumatological conditions. So thank you again, everybody, for your time today. It was great to join you from rainy Vancouver, and we hope everyone has a great night. Thanks so much, guys.